In-depth analysis of just how South Africans in general are dealing with the impact of the lockdown. I'm joined via Skype by Angelo Fick, a director of research at the Auwal Socio-Economic Research Institute. Angelo, a very good evening to you. Thank you so much for joining us. Welcome.
Good evening.
Let's first start our conversation, Angelo, with emerging voices from politicians and even some in the middle class, as we see on social media, trying to put pressure on the government to remove the lockdown. Surely these calls appear to be going very much against expert advice from scientists whom I believe have more authority on this issue.
So the scientific community that is advising the South African government has indicated why the lockdown needed to happen to begin with. And that had to do with, one, preparing the healthcare system in order to cope with what will come to us in the middle of this year and possibly into the second half of this year. And secondly, to use this lockdown period to trace and track how the disease is moving and in that way have a dynamic response to the disease outbreak when it is in full flare mid-year. Now, the calls to change the lockdown or to shift out of it, I think must take into account the historical experience of countries that have done so and countries that continue to do so. So we know that countries that came out of the lockdown earlier than they should have or could have seen problems with the actual second phase of infection. And then there are countries that never went into lockdown and they are currently struggling with high numbers of deaths, and also with the economic consequences of high numbers of deaths. So it is, as Natasha Piri pointed out, a very difficult balancing act for government, but it is one that is at the moment seemingly taking its heed and lead from the epidemiological science team that is informing its processes.
You know, Angelo, when the lockdown started, I mean, when the challenge of coronavirus in its entirety started in South Africa, the whole country was united and some, if not all, the political parties rallied behind President Cyril Ramaphosa. But now it seems they are pulling in different directions and they're speaking in different voices. So what could perhaps have necessitated the change of heart?
I think that the constituents of the political parties may be putting pressure on the politicians, and I think some politicians in South Africa may be taking their cue from developments elsewhere in the world, and also from, I think, a very fundamental misunderstanding of how this disease is moving and working. Epidemiologists have indicated to us that the numbers that we are seeing at the moment are simply indications of the disease's current state over the last 14 or so days. If we take the disease's movement and changes elsewhere and the political consequences of those changes, the worst case scenarios are 4 weeks ago, Italy and Spain, currently the United Kingdom, Sweden and the United States. Mm-hmm. The best case scenarios that we have seen include New Zealand and to a different extent and in a very different way, South Korea. Now, this is not to mean that we should simply wholly import those models, but we should look at those models and see what is positive in them. And in South Africa, the lockdown has been difficult for very many people and for very different reasons. For many of us in the middle classes, the lockdown may have been inconvenient and it may have cut into a certain amount of our ability to generate income, what people are, I think, mistakenly calling civil liberties. But for the majority of South Africans, this has been a real crisis, a crisis of hunger, a crisis of security, a crisis of day-to-day living. And I think the approach that says we must balance out economic return to what we had before March 26th in order to save those lives is a blind approach because it simply refuses to imagine other possibilities of intervening to alleviate hunger and deprivation. And those, I think, are going to be very, very essential, not just for this particular crisis, but in order to build a very different South Africa coming out of COVID-19 that is certainly more equal, because we cannot sustain the great inequality of income and great inequality of wealth, as well as the consequences of those in the social fabric for millions of people in South Africa beyond COVID-19. We cannot return to life as we knew it, because that would simply, as very many people have indicated, put a whole group of people as expendable. They would simply die because they do not have the resources and do not have the health facilities available to them that many imagine is the norm. And here I think it's crucial for government to be held accountable, that they should have a much more coordinated and carefully constructed intervention around people's hunger, and two, that they should clamp down on the extreme activity and the excesses of the defense force and the police services, and at the same time on the corrupt corrupt officials at local level who have been diverting resources meant for ordinary people away from them.
And I think you are now touching, in greater detail around the issue of communication and the dissemination of information. Now, the team at the forefront of the fight against the coronavirus here at home have been telling us that the worst is still yet to come. I mean, some experts have said that as we approach winter, we'll see a peak of the infection rate. But it would appear that some don't quite believe this. Is the message losing credibility it carried at the beginning, or could the influence be coming from what people see happening in other parts of the world?
So I think there is a significant scientific misunderstanding around viruses and how they spread and what their effects are, and of the basic epidemiology, despite the, I think, very careful and very detailed explanation by Professor Abdul Karim earlier this month, or earlier this year, about a month ago. I think we need to bear in mind that the numbers that we are seeing can be quite deceptive. They do not indicate at all the peak of the infection rates that we're likely to see, nor do they really show the death toll that we're likely to face. Professor Salim Abdul Karim indicated that there would be deaths and that we should prepare ourselves for the social cost as well as the individual and psychological cost of the numbers of deaths we're going to have. Now, for some people, a 2% or a 4% death rate might seem negligible, but we have in this country lived through crises where that was the death toll for 350,000 people dying in KwaZulu-Natal in the AIDS pandemic, leaving social disarray and longer consequences for the children who have to grow up in households where they have had to bury two adults caring for them. So we cannot have a situation which repeats that on multiple levels across the country. So we need to make a very tough set of decisions around whether we foreground economic activity for profit, which is very different from economic activity for sustenance. And I think they're often conflated. And we need to distinguish between absolutely essential economic activity and the kind of economic activity that would be nice to have at levels 3, 2, and 1, but that we can actually at this moment do without. And this means many of us in the middle classes will have to give up, have to sacrifice a certain kind of luxury and freedom to consume that we had before. And what needs to be foregrounded now is the production of food, the distribution of food. The food networks need to be put in place. Nutrition needs to be kept up for everybody, including those young children who would have gotten school feeding scheme meals. The health of the elderly needs to be taken care of. And here, not just the physical health in relation to COVID-19, but health issues beyond COVID-19, given the other health challenges in South Africa. And also given the complex family and social structures of South Africa, it is very easy from the luxury of a certain position to say that, well, the people who will die would have died anyway. But the consequences of that for the survivors would be immense. And it would be tragic if we were to suddenly take a Malthusian approach and begin to decide, before we've even needed to, which lives are worth saving and which lives are worth sacrificing, knowing that those are going to be the consequences. I think the kind of Trumpian approach that we're seeing elsewhere in the world is not one that in South Africa would be either morally defensible or even at the level of ethics explicable. And I think it's irresponsible of people to imagine that it'll be somebody else's parents who are in their 80s who will die. Right. It's somebody else's relatives. It's really going to affect all of us if we live in a society of even 2% of the people who will become infected with this disease end up dead.
And I guess that is the problem, Angelo, the fact that so many South Africans find it very hard to sacrifice some of the luxuries that they've grown accustomed to, hence exerting pressure on the authorities to lift this lockdown. And the impact of this lockdown has certainly been felt by all South Africans, but even more so by the poorest of the poor and the middle class. So surely now the focus should be on helping the poorest of the poor cope with this virus, that the inconvenience suffered by those looking to return to what life was before the virus hit us at the beginning of March, isn't it?
So in South Africa, we have a fairly weak social contract. And so the idea of standing with people who are very different from us has been very hard. We've had the myth of the Rainbow Nation. We have the unraveling myth of the New Dawn, where people just imagine that without having to do anything, we will somehow all be together. The sentimental yearning for fraternity is, I think, something that does need to be backed up by social action. And here, I think standing in solidarity with people means that you are willing to give up some of the things that you imagine you couldn't live without and having to begin to live without them because they're not actually basic needs. I've watched hundreds of videos of Japanese professional rugby players showing exercises to a country like Japan, where people live in very small apartments and trying to keep fit as professional athletes. And I've been slightly aghast at South Africans who can't imagine doing yoga inside their homes, who feel the need to have to go outside because it is part of their conception of freedom. And I think that speaks to a failure of imagination on those who have, in post-apartheid South Africa, to begin to think of what would be required to show social solidarity with those who have not, and then to go beyond simply standing in social solidarity, but actually working actively to provide those people who are currently doing without with what they need. And that means anything from spending what would have been one's transport budget, if one continues to have an income under these circumstances, on food, or giving it to people as cash so that they can buy their own food, of not going out unless it's absolutely required, and doing all sorts of things in very different ways if you're in the middle classes. We all know working class people. This idea that South Africa, the spatial dynamics of apartheid means that we don't know working class people is silly. We have worked in spaces with them. We have gone to churches with them, into other forms of religious worship with them. They work for us. So how we sustain ourselves through this is not beginning with a Malthusian formula that says these are the economically useful people who should survive, and these are people who, they would have died anyway, so let's sacrifice them. That kind of thinking is, I think, a really unpleasant symptom of the horrible sort of world we have built over the last few centuries, but particularly in South Africa over the last 25 years, that we now have an opportunity to undo, unmake, and remake in a new way a world that we can all begin to live in together. Because I think what we do have in common, even as we sit with different forms of material largesse and or deprivation, is that we're almost all equally vulnerable to this invisible pathogen that could potentially kill us. We don't really know enough about the disease, as the scientists keep telling us, and that they're still gathering information from clinical observations on the ground. And so these premature declarations of what is the best way to do the sort of emergence out of this crisis is, I think, a sign of people who are grasping onto unscientific thinking, ignoring scientific advice, not just from the South African example, but from around the world, and not just from the World Health Organization, but from actual physicians on the ground who have gone to great lengths to indicate what the various failures have been and what the successes could be if we simply stuck with it.
All right, Angelo, thank you so much for your time. I guess the most important thing now is to look at life post-COVID-19 and whether we can realistically expect to go back to how things used to be. We appreciate your thoughts and your insights. That was Angelo Fick, the Director of Research at the Auwal Socio-Economic Research Institute, joining us on the line. All right, this